Alright, patient, we're going to start by examining your neck. So first I'm just going to look at your skin, look for any lesions, rashes, hairy moles, anything like that. Next I'm going to look at your thyroid gland, so if you could just extend your neck a little bit for me. I'm going to shine the light gently and look for any swelling or anything like that. Look at the other side. Looks pretty good to me. Next, I would palpate it. So I'm just going to find the Adam's apple and go a little bit lateral and inferior. Palpating the thyroid gland, making sure it's equal on both sides. Feels pretty good to me. So now I would do the swallow test. Again, I would just have my hands on the thyroid gland, ask my patient to swallow. Make sure they both go up and down equally, which they did. So you pass the swallow test. Next, we would move on to the trachea, which the first thing I'm going to do is just look at it, make sure it's not deviated to one side or the other. Looks pretty normal. The next thing I do is just kind of palpate right here with the 3 fingers and ask him to swallow. Good, and there I'm feeling for the pull of my finger on the trachea while he swallows. The next thing is the lymph nodes. So with the lymph nodes, patient, you're just going to be sitting there, and I'm just going to palpate around for lymph nodes. First one is in front of the ear, then behind the ear, then down by the jaw, submandible area, submental, carotid area, down here. Yeah, I got to review some of those. There's also an occipital one. So next I'm going to be looking at the carotid artery, and I'm just going to be listening for that, for any bruit. Make sure it's on the bell, which it is. And I'm listening for 35 seconds. The last 2 are just muscle strength tests, so SCM and strength test. So can you just try to shrug your shoulders? Good, and then resist against here, and resist against here. Good, and those were both 5 out of 5 for muscle strength, and that's the neck.